everyone, and welcome to the Own Your Health podcast series. My name is Rhoda Robinson. It is my pleasure to have you on today's episode. And joining us today is the esteemed one and only Dr. Esiet.
Thank you for having me, Rhoda, and this very, very important podcast.
Thank you so much. Okay, so we're just going to dive right into it. For the benefits of our guests who do not know you, I don't know why they don't know you as of this moment, but let's just help them out. Could you introduce yourself to everyone listening and watching out there?
Okay, you already know my name. I'm Esiet. I work for an organization called Action Health Incorporated. I'm a medical doctor, public health expert, and social development advocate, and I've been working with around youth health in the last 35 years of my life.
Oh, wow. I'm sure a lot of you out there are not up to 35 years. So he has literally been doing this all your life. Thank you so much, sir, for honoring our invitation. We're truly glad to have you here.
I'm excited to be here with you.
Now, I think just to start us off, right, where are we right now when it comes to young people's sexual and reproductive health?
Where are we? Where we are? Where we are is that, unfortunately, Nigeria has not been investing as it ought to in the sexual and reproductive health and rights of our young people. And fundamentally, we are not very, very consistent in the way they receive information and the rightness of the information, the age appropriateness of the information, and the inclusiveness of the information. And most of the current efforts are towards those young people that are in school. Almost every other young person who is not in school is deprived of access to information, which in any case all boils down to one thing, that we are not optimizing the human rights of our adolescents and young people.
So how do we fix this? Now, you said that a lot of efforts are targeted towards young people in school, right? And they are getting most of the information. However, we still see those statistics that show that their health is still not where it's supposed to be. And just imagine what that would mean for young people who do not actually have this information already. So it must be a dire situation for them. Now, how do we get it to them? How do we solve this problem?
You know, this information is not just like any other information, specialized information. It's indeed a body of knowledge, what we call sexuality education. And it is broad, it is deep, it has also to be age appropriate, it has also to be gender inclusive, because what we currently have are like pushing the ongoing stereotypes that we have in our society that are, for instance, not prioritized the issues of women and girls. So we have to be at the point where curriculum is being developed and infused at appropriate, and also train the persons who will be delivering this. This can be delivered by parents if they are trained. It can be delivered by teachers. It can be delivered by social workers. It can even be delivered by people from the religious communities. What is missing is that we don't seem to have the political will long enough and consistently enough to be able to do this. But it's very sad to know that all our sexual and reproductive health indices in this country, especially around young people, are bad.
No, I completely agree with you that it takes more than one person to provide the information that young people need. It's all our responsibilities, from the teachers in the schools to the parents at home to your neighbor who sells something on the roadside, being able to have the right information to give to the young person who needs it the most. Now, I know currently AHI has been working on the curriculum you had talked about, the FLHE curriculum on training educators on how to provide that information to young people. How has that impacted the access of information to young people?
Well, we have been able to work at the junior secondary school level, mainly public junior secondary school, specifically in Lagos State, using the national curriculum. And you will also agree with me that the education in Lagos, there are a lot of private schools. They are not even paying attention to it. Younger children in the primary schools are not getting access, and students in senior secondary school are not getting access to this same information. So we just confine this to the 3 years in junior secondary school, public junior secondary schools. When you look at it over the period of time, we could say, yes, we have reached millions, but the challenging thing is that the FLHE curriculum is a watered down sexuality education curriculum. So they are not getting all the information they need. We are only hoping that civil society groups, NGOs like HACEY, Action Health, and others, PPFN and the rest, can provide also for these young people. But I can tell you, we still have a long way to go.
Now that, of course, we're in the digital age and a lot more young people are online, both those in school and out of school, how do you see that space as a tool to actually provide the missing information? Now, you said that the information being passed in school has been watered down. One, it's only reaching a section of the young people in schools. And so we have those before that and we have those after it. Now, how do we provide that missing information? And especially to those that don't even have the benefit of being in school to get the information in the first place?
Well, I know there are a lot of digital initiatives that are ongoing. There's the Soft Life 247 that UNFP and UNESCO supported Action Health to roll out. I know HACEY, many other organizations are doing great stuff. But the challenge also is that there's a cost to digital access.
Yes.
And the young people don't have the resources to be able to sustain. So whilst digital is encouraged, I think we need to use every means. And the first challenge is that we need a national health promotion framework that every government agency or every government at federal, subnational level and local government level must subscribe to. Because if we do not have that, then it's difficult for us to be able to track. I know that HIV and AIDS have been a vehicle by which we have brought all of this into the national consciousness. And I want to think that the National Agency for the Control of AIDS needs to forcefully take its rightful position because they are charged with the mandate to coordinate the response. And this is a key deliverable in the national response. I know that at a meeting that I was this week, I was telling the Lagos State AIDS Control Agency project director that they need to take this forward and they need to invite the Director General of the National Agency for the Control of AIDS to come and witness an HIV and AIDS education forum. And I still mentioned it informally to a staff of that agency today to say, listen, they've dropped the ball for too many years and we need to pick it up. Not because it will automatically resolve the gap, but it will begin to redirect us to doing what is very fundamental to making a difference. We also need to engage with the creative arts industry. We need to create with the sports industry, everywhere that we know that people are brought together. In fact, Religions for Peace is a global association that just released a very important document, I think in November last year, in which the Sultan of Sokoto and Cardinal Onayekon are the two most prominent Nigerian religious leaders that are in that body, that they need to use to work with the religious communities in Nigeria. Because if we can harness all of these efforts, then we will be breaking barriers and reaching our target. And that is going to be very useful for us. And I'm saying this mindful that the duty bearers for young people are not going to be reached through digital and curricular teaching. So we need to find a way, and we need to work with the media in a more consistent manner.
I completely agree with you on that. I remember growing up, one of my favorite programs was I Need to Know.
Yes.
I learned so much. My mother then would just put us in front of the TV and say, I am busy, but watch this. You will learn a lot. Pay attention. And I think that's what is missing in our media right now. A lot of the content that is being developed, a lot of the message that is being passed out, they are superficial.
Yeah.
They are not contributing to the minds of the young people. They are not crafting their behavior to be to actually protect themselves and make the right choices for themselves. And I think that's something that we really need to start talking about more and start acting more on. And you had also mentioned the fact that NACA, as the National Agency for the Control of HIV and AIDS, needs to stand up. They need to take responsibility for the control of AIDS amongst young people. I think right now Nigeria still has one of the highest youth population of HIV new infections.
Actually, NACA has a document for strategy for reaching adolescents in Nigeria that was released towards the end of last year. They call it the Generation Negative. And the fundamental reason is because that population is the one driving the current HIV epidemic in Nigeria. Data has shown that not even the high-risk people. And it's because there has been a neglect. And I want to believe that, especially if civil society organizations that are credible can come together at leadership level, we can engage in a more constructive manner. Of course, we'll bring in NINETA as well, and then the Association of Positive Youth of Nigeria, and then we can engage with NACA to say, listen, we cannot afford to sit on the fence. I looked at that document, and I can tell you that FLH was not mentioned. So
that's a problem.
So we may want to be politically correct, but are we technically correct? And NACA is a technical agency, and therefore it must do all within its powers to push what is factual, what is technically right, what is evidence-based to the policymakers so that they can begin to understand. Because now we need to be co-creating solutions, and we are not getting at that. And I hope maybe HACEY can have a podcast with the DG of NACA.
Hopefully
so
very soon.
Because this is going to be critical for this nation going forward.
Now, you had mentioned about CSO leadership, right? And I can say that I've met a lot of CSOs. I've worked with a lot of CSOs that are doing good work in young people's sexual and reproductive health and rights. But the numbers are still horrible. The negative numbers keep increasing every single day. That Nigeria is the leader for almost every negative indices when it comes to young people's sexual and reproductive health. What are we doing wrong?
I think the first thing is that information does not affect behavior. Smoking kills, but many more people are smoking. So it's like an information billboard. We want to move to behavioral change, which is where the issue is. Many of the civil society organizations, unfortunately, are on the information, education, and communication activities. They are not doing
behavioral change,
social and behavioral change, because some of these things are deep-rooted in norms, trust, for instance, in a relationship means that condom use disappears. And the moment that disappears, HIV no dey show for face. That's the slogan. So the person who looks very healthy by visual parameters may be nursing or nurturing a virus. So these are things we need to address. And powerlessness, voicelessness, these are things we need to address. You can look at vulnerability scale. If you're a woman, you are below, say, 18, you have a disability, you come from a poor socioeconomic background, the vulnerability of that person has heightened. So how do you do it? Who is talking about consent? Who is teaching about consent? How are we encouraging the notion that men have had over the years that when a woman says no,
it means yes.
So these are things we need to challenge ourselves, and all of those things. So we are not even at the threshold of a breakthrough. That's the truth. We are still at the point of many activities. Many civil society organizations think that inviting young people or adolescents into a program is youth participation. Attendance is not participation. Attendance is what it is. Attendance, fill the stadium. But what did you do? You came and said something to them, they clapped, they went out, they collected meat pie or moi moi, they got transport, they got a t-shirt, they got a face cap. They did not interrogate the subject. There are conversations that we must learn to catalyze in small spaces for boys to know. I remember someone asked me, what does it take to be a real man? And I say a real man is a man who can cry, who has emotions, who has empathy, who has sympathy, who feels what you feel. That is a real man, not a macho man. You can have all your biceps and all your muscles well developed, but you are just not there. You are arrogant, you are self-centered, and you are just looking at your own interest, not the interest of your partner.
Yeah, you said so many things, and one of the key things is that attendance is not participation.
No, it's
a
not.
lot of times you find organizations designing programs for young people by old people, and it does not include any say from that young person's perspective. It does not include their voice. It does not include their thoughts. It does not include their experience. It's just a textbook representation of what a young people needs. I think that's something that we need to start changing at the leadership level, because that's what you said. That a lot of CSOs now are missing the way. They are focused more on activity rather than impact, lasting impact. Everybody wants to shine in the space to say, I am doing something, but who is actually doing the work? We need to start figuring out and working with those who actually do that work and are there to actually make a lasting impression. Now, you also said something about going from national actually adopting frameworks that work. I want you to actually spread more light on that.
Nigeria is a federal republic, which means we have federating units. And the federating units are called states and the Federal Capital Territory. So, education, information, most of these things are on the concurrent list of the Constitution. So the federal does not have a monopoly. And because we are in a democracy, you need to, even if you have thought it through, you have evidence, you have this, you design it, you cost it, and we begin to put resources. Then states can take it based on their peculiarities. In a state where what the challenge is economic or livelihood access for women and girls, then that is a critical area for their own investment, because in some other states, that is not the most critical need. They know that their challenge is the religious and social norms that are keeping the women down. So that is what they need to focus to address. And once they begin to do that, then you'll begin to see a turnaround. So one cap does not fit all. And that is why, even though there's going to be a national framework, state must contextualize. And when it gets into a local government, different local governments have different challenges, even within the
Even
same
within
state.
the same space, yes.
So then they further take a look at what they have to do. And it may shock you that in some of our smaller levels, women are even so powerful. They are the custodians of the culture, they are the custodians of the economy, they are the custodians of governance, So, but what is their mindset currently? Do they need a mind shift? Because if their mindset is advocating that patriarchy must be upheld as is, then they become even dangerous to themselves.
Exactly.
Because where you see some terrible widowhood rights, they are not performed on women by men. They are performed by women on women. So these are things that we need to address.
And how effective do you think frameworks and policies would be in changing this?
Well, they provide guidelines and they provide a pathway, but in terms of a timeline, if they are funded and well supported, give yourself 20, 25 to 30 years, begin to see real impact. If they are diligently applied. Because, listen, the generation, my own generation now, I'm 67, they have to go away. The generation after me must go away. Another generation must go away. Whilst we are raising a fresh generation that will believe that a woman is more equal than a man. And I say this because physiologically, if you understand the way this chromosomal arrangement is made, we are all more female than male. And that is why we all have XX and XY. So, which means that people with X's are more. So the females and all the males. But people with Y chromosomes are few or are fewer in our context. So we are all, in this, and we just need to retool our minds, rethink, It is not right to decide that a woman's role is limited, while the man's role is open. It is not right to accept that a man, for instance, can have multiple partners, but a woman will be judged if she has
more than one.
So these are things that people don't see, or we just pretend. I mean, I could remember almost all, and I don't want to mention disrespectfully the name of our leaders in politics, but most of the men have more than one partner or one wife. But if a woman has been married or has had multiple relationships over a period of time, which is serial monogamy, she'll be stigmatized. Oh, she had a child for a man from X, he had this, and but why? And it is because the standard of justice, especially sexual justice, is skewed against the woman and not the man. So these are issues that we need to think about. And then we need to think about inclusivity in a broader perspective. I always tell people that from what we know from chromosomal studies now, and this is pure science, you can have X, X, XY, and varying combinations. So if you meet somebody with XXXY, will that person behave like I am with XY? If you have somebody with XYY, what will that mean? And so this human spectrum is male, female, and anything in between.
I think a lot of people have chosen to be blind to that fact because a lot of people see in either black and white, or they want to see in either black or white because it makes it easier for them to justify actions, to justify the power that they have to control over. And I believe, as you said, inclusivity needs to be spoken about more because no matter how much we want to ignore it, it still exists and we need to account for it. We need to be responsible for those people that find themselves in our so-called gray area of identity, of being part of the human race, right? So now I want to ask a question now, just moving a bit back towards our young people's access right now. AHI has, to my experience now, I'm not talking based on the fact that I heard, but I have experienced, right? AHI's provision of youth-friendly services, youth-friendly health services for young people. We've engaged with a lot of young people, and none of them want to visit a health facility because of how they're looked at when they ask for anything related to their sexual and reproductive health. How do we fix this? Because we've talked about it. We've talked about rights. We've talked about agency. We've told the young people that you have the right to do this. You have the right to ask for this. However, we still have that gap there. How do we fix that gap?
Well, thank you. This is a very critical thing. I start by telling anybody that on an organization, no matter the name, whether governmental or non-governmental, does not become youth-friendly until every staff member becomes youth-friendly. Because youth-friendliness is a way of life, it's an attitude. And if the persons in an organization don't have it, it won't work. You can have healthcare providers in a facility that are youth-friendly, but is the gate man youth-friendly? Is the record
Keeper.
youth-friendly? And all the other persons that the young person will meet. In one of the works we did earlier in Borno State many years ago, they decided to give us a space away from the hospital for youth-friendly health services. So all the adults felt now that, okay, when young people go to that facility, they are going to have an abortion.
Or
So getting young people to come there became very difficult. So we then said, okay, put us within the hospital framework and let us see how to add one or two other things to make it such that young people will not be stigmatized or looked down on and all of that. Because you don't forget that healthcare providers also live in the society. So if the healthcare provider is not mindful, you go to church or you go to your mosque, and the preaching is against you, that you are the one corrupting young people, then there is a problem. So we need a whole community understanding of youth friendliness. And the moment we can achieve that, providing services becomes very simple. It starts with something as simple as access. Is a young person, am I accessible to that young person? If the young person feels comfortable with me, we can punch a knuckle to each other or do a high five. Then the young person begins to think that I can talk to you. And if I cannot even render that service, I can channel the young person to where that service can be given. I can tell you some of the services people have approached us for, and we couldn't, and we had to send to other agencies that could provide. We have had to work with DSVA around GBV and get people to be in their halfway homes while their perpetrators are arrested. So it's a conundrum. It's not a one effort will resolve it. It's something that all of us must come to agree. And that fundamentally, all human beings, or most human beings, let me rephrase it, are sexual beings. Because I've also met asexual people, and they have a right to life, and we must respect that. But most human beings are sexual beings, and so we must promote positive sexuality and positive relationships.
Thank you. Thank you so much. I heard one thing that you did say, and I think it's something that a lot of us, we've overlooked. And I can say I've been guilty of that as well. Trying to provide youth-friendly services in a single physical structure and not in the community. So let's start thinking about it like that. So wherever you see a physical facility, youth-friendly services has to happen at the community level before that facility is accessible to a young person. So let's change your thinking. I'm pointing to you. Change your thinking. Okay. Now, before we round up, over the next couple of minutes, I just want us to talk about how do we get to where we are now. As an organization, we've been working on ensuring that young people have access. Young people can express themselves. Service providers are able to offer their services to young people, and young people know where they are. But we realize that a lot of times it looks like we are pouring cups of water into the ocean. We don't know how far we've gone. We don't know how this is affecting the change we want to see on a national, a state community, state and national level, even at the global level. How do all this connect, right? So we've thought about a scorecard. We've thought about how do we use that as a tool to actually guide our actions. And I wanted to get your own perspective on this, because I know for a fact that you've been in a lot of processes where tools like this, scorecards, frameworks have been developed. How do we ensure that we are able to do the right thing?
All right. First is that you must own it. I think the biggest flaw in our thinking most times is that you think somebody else will own your vision. No, no, they won't. So you begin to become the conscience of the scorecard. And irrespective of the inadequacies or gaps in the scorecard, you stay consistent and you continue to improve. It will get to a point, and that is when tipping point is called tipping point. If you've read the book by Malcolm Gladwell, it's titled Tipping Point. When change will come, you see, people will not adopt. The early adopters will quickly adopt it and be referring to it, but late adopters will come in much later. Sexual and reproductive health is political, very contentious, has an economic track, and it can mean access to resources or denial of resources. So it has many dimensions to it. And so the moment you own it and you are dogged and you remain focused on it and you are consistent in bringing out it out, you want to be bringing out annually, once in 2 years, once in 3 years, once in 4 years, so that everybody begins to look to wait for this big event and you announce it with a bang. And so people begin to find, where am I? Like the NDHS, NDHS does not come annually.
No, it doesn't.
But if you think you have capacity, I'm talking about technical and financial resources, then it can. And after you've released it, you must engage to explain. Because if you give a scorecard to a politician, so what do you want me to do? A scorecard is not the same thing as me commissioning a block of classrooms.
True. And that one has more points to it.
Yes. So, so, madam, you brought me scorecard, so why now? So what do I do with this now? until you can explain. A former president of Nigeria, so that I will not be accused if I mention his name, the way a friend and a colleague was able to explain maternal mortality to him was, he said, sir, if you have one plane crash every day in Nigeria for 1 month, what will you do? The president said, what will I do? I would declare an emergency in the aviation sector. How can we be having a plane crash? He said, and that plane carries 150 people, sir. I said, yes, I know what I'm saying. He said, but that's what has been happening. 150 women die every day from preventable deaths by being pregnant. He said, eh? And then he asked the then Minister for Health, and he spoke in vernacular. Is that true? And the minister said, but that's the figure, sir. Then, there and then, the president appointed this person as special advisor on maternal mortality. But you know the snag is to work through the Ministry of Health with the minister. So the person became ineffective.
Oh.
But you can see the graphic representation that a plane is crashing every day for 1 week in Nigeria. And the president felt enriched. So these are some of the things, because again, our messaging, and how do we make it? So now there's a message. It's scary. I want to act. What are the simple things that I need to do? So the scorecard is a good idea, innovative. It will contribute to the body of knowledge and advocacy, but it must go beyond advocacy. So it must become an advocacy plus. And the plus will be messages and what are the things that can be done and how can they be done, and very quickly. And and if you also study this region in India called Kerala, when they had a problem, there was a targeted focus and response to the community to say, look, how do we work in this community to bring down maternal mortality? And it was well documented. So a scorecard is not just the only tool, it carries with it a lot of other responsibilities.
And I think that's what we usually miss when we develop frameworks and tools and all that stuff. We just bring out pretty pictures with colors, green, red, and yellow. And we just present it and say, here you go, this is your report card. And then we wait for the next step to happen again. So I'm wondering, how do we make sure that this is an inclusive process? Because I've seen the different scorecards that exist. And of course, the most popular is the RMNCHE scorecard and how it's being used and its adoption and all. And I'm thinking, how do we not make the same mistakes that people have been making? You had said earlier, around the beginning of this conversation, that really the problem is with that leadership. We are not bringing our heads together. We are not really thinking of that future that we want to solve. How do we make sure that our ideas are speaking to the future that we need?
I'm not being prescriptive, but I think that anytime you want to generate thoughts, some generate thoughts in solitude, some within a group. What I believe is that we must be accommodative. And we must use multiple approaches. But some core group must work together to say, okay, for this scorecard to have a meaning, what are the gaps in the current scorecards that we'll seek to address? I will tell you, a meeting happened in Porto. It's called the First World Sexual Health Assembly. And I've seen there's a Porto proclamation that was released, I think yesterday or yesterday, from that meeting. It's just a beginning. And I don't want anybody to think that starting, you can resolve all the issues with the first attempt. But let that attempt come, and let's take it forward from there. Let it not be a one-off thing to say, we'll produce a scorecard in 2025 or 2026, and then what next? And that's why for me, there has to be a sustainability mechanism, and then you can begin to bring other people in. For instance, the issues of sexual and gender identity, how do we ensure? The issues of people with disabilities, how do we ensure? The issues of asexual community, how do we ensure? The issues, sex workers, how do we ensure? So multiple groups. So what are their issues? A young person who is 18 or 19, or between 18 and 19, who decides that, look, part of my life I want to have sex. How do you ensure that you keep lived experiences? I live on the street, so I survive on the street. An injection drug user, or somebody who lives on abusing drugs. So how do we ensure? So we cannot capture everybody at the same time, but let's start. And then we can begin to see. And then how do you determine access to information? And what is the theory of change around that information? So there's a whole lot. But I always believe that, look, let's do it.
Thank you so much. And on that note, we will draw the curtain on today's episode of the podcast. Thank you once again to our guest, Dr. Esiet, who has graciously shared his wealth of knowledge with us and has told us one very key thing. Let's do it. No matter what we think, let's do it first. We might not be able to solve all the problems at once, but let's start with one. So thank you all so much. Thank you again for joining us.
It's my privilege.
Thank you so much. I will see you on the next episode.